Have you ever wondered when persistent sinus issues in cystic fibrosis might signal a need for more than just routine care? It is a common concern, and knowing what to look for can be incredibly helpful. For individuals with cystic fibrosis, signs that might indicate a need for sinus surgery typically include ongoing severe nasal congestion, persistent facial pain or pressure, and frequent, stubborn sinus infections that do not respond well to other treatments. These symptoms can significantly impact quality of life and lung health. The why behind these symptoms for someone with cystic fibrosis is rooted in how the condition affects mucus production. The faulty cystic fibrosis transmembrane conductance regulator protein, or CFTR, leads to thick, sticky mucus not only in the lungs but also in the sinuses. This abnormal mucus clogs the sinus drainage pathways, creating a perfect environment for chronic inflammation and bacterial growth. Over time, this can lead to nasal polyps, which are non-cancerous growths, further obstructing airflow and drainage. When these blockages and infections become chronic and severe, they can make everyday breathing difficult and contribute to overall systemic inflammation, potentially impacting lung function. If you are experiencing these persistent and troubling sinus symptoms, the first crucial step is to communicate clearly and openly with your cystic fibrosis care team. They will likely recommend a thorough evaluation, which often includes a detailed physical examination, potentially an endoscopic look inside your nasal passages, and imaging such as a CT scan of your sinuses. This comprehensive assessment helps your team understand the extent of the blockage and inflammation, and whether medical treatments like antibiotics, nasal steroids, or mucus thinners have been exhausted. A key insight in managing cystic fibrosis sinus issues is understanding the role of a multidisciplinary team. An ear, nose, and throat specialist, often called an ENT, who is familiar with cystic fibrosis, will work closely with your pulmonologist. This collaborative approach ensures that any decision regarding surgery considers both your sinus health and your overall lung health. Functional endoscopic sinus surgery, or FESS, is a common procedure designed to clear blocked sinus passages and remove polyps, improving drainage and ventilation. Recognizing the signs of severe and managed sinus problems in cystic fibrosis and actively engaging with your specialized care team empowers you to make informed decisions about your treatment path. Addressing these chronic sinus issues effectively can lead to improved breathing, fewer infections, reduced facial discomfort, and ultimately a better quality of life and potentially better lung health outcomes.